hope this doesn't last all night again. I don't have a need to pull all-nighter. I just don't.
Yeah, I just can't grasp the concepts of bronchoconstriction and bronchodilation.
Did you hear that?
Hear what?
You've been acting a little weird lately, Stephanie.
Every time Jagt comes to the library at night, I hear things. Haven't you heard about the guy in the dock?
No.
You haven't heard about the guy in the dock. It's the whole reason UNF is banning smoking.
Okay, he was outside smoking a cigarette by the pond. He started coughing uncontrollably. He fell in and the duck drowned him. Now they say he haunts the library. Okay.
You're crazy. I'm going to the bathroom.
I swear, that's it. That's done. I hear stuff every time I'm here.
Man, what's happened to Karlene? She has been gone for so long. I have to keep going. Like, I can't wait. I can't wait for her any longer. We gotta keep moving. I gotta go home sometime tonight.
Let's just get into the chronic diseases.
It's okay. What is going on?
What? What are you looking at? That's the guy that got drowned by the duck.
We're not
scared of you.
Do you even know why you died? It's not because of the big yellow ducky that's in the lake that drowned you. It's because you have chronic bronchitis.
What is chronic bronchitis?
Chronic bronchitis is a type of chronic obstructive pulmonary disease. It's because you're a smoker. It's the #1 leading cause of chronic bronchitis. Here, I'll show you. See here, chronic bronchitis is caused by hypersecretion of mucus by the goblet cells in the bronchial tree. This causes a restriction of airflow in the bronchial tubes, and this airflow creates like a revolving door effect. The main function basically of mucus is to protect the lungs from any harmful substances that are coming through the air. With that being said, the oversecretion in chronic bronchitis creates a smaller diameter in the bronchial airways that it's harder to get airflow in, which equals to more breaths that need to be taken, which also equals to more mucus that's secreted. So hence the revolving door effect.
Yeah, it wasn't smoker's cough.
It wasn't?
No, I bet you were sick a lot. Didn't you notice the wheezing at first and the phlegmy cough that lasted for months? Smokers are prone to getting sicker longer. I bet you were fatigued. That was because you weren't getting enough oxygen to your blood. That's also why your lips were blue, or are blue. That's called cyanosis. If you hadn't fallen in the pond, eventually your ankles and legs would have swollen because your body would have restricted blood flow to your lower extremities and routed it to your vital organs.
And you know, I wouldn't have necessarily killed you if you had gone to your doctor as soon as you noticed that you had your smoker's cough. Doctors normally perform diagnostic tests when they have an indication that someone might have COPD. They check your medical history, and then they perform certain tests like the complete blood count, atrial blood gas measurements, and CT scans of the chest. They also take a chest x-ray to make sure and to rule out other lung diseases. And then finally, they do a pulmonary function test to characterize the structure and the function of your lungs.
Is this even curable?
Depending on what stage of chronic bronchitis, it could have been treated with an inhaled bronchodilator, such as albuterol, which relaxes the smooth muscles of the bronchi. Inhaled steroids such as prednisone help reduce the inflammation reactions and reduce bronchial swelling and mucus production. Also, as a preventative measure, chronic bronchitis patients should get the flu and pneumonia shots and avoid cold and dry environments. Often, they all undergo pulmonary rehabilitation and sometimes also require some supplemental oxygen therapy.
Thanks for the info. Maybe I'll start hunting smokers only. Then it can be a positive hunt, and I'll end up telling them what could happen to them if they don't stop smoking.
Good. I hope I never see you again. So, good luck to you. On the way out, would you please turn the lights back on? I need my homework done.